We save lives every day at Amaze, and that's not a cliche. I mean, the number of suicides that we know we've prevented. We've had people curled up in a ball on the floor in a dark, their dark bedroom, the windows closed, right, with a bottle of pills in their hands, and they've already made their decision. They're going to swallow. But it was so easy to call Amaze, and talking to a therapist or just a doctor, and they're all trained in the basics of mental health, within seconds, you've saved lives when those things happen.
If you don't mind, there was a story you were sharing with me earlier in the studio here about the gentleman that interacted with Amaze on that same line, and there's a very clear path for you guys probably preventing a suicide. Could you share that with us?
Yeah, I mean, true story. 9:12 in the morning, and the time is kind of seared in my head.
Because, you said it specifically earlier,
it was kind of a traumatic event for the whole team.
Yeah.
At 9:12 in the morning, we get a message through our app, planning to kill myself today.
Okay.
So, at Amaze, everybody's part of one team, right? It's not that we've contracted with doctors all over the country and we'll transfer your call to some doc who's sitting at home taking some calls to make some extra money or while they're winding down their career. So that message immediately pops up on a screen. It's kind of like a Kanban board in manufacturing. Pops up on a screen, so everybody that's on duty and working together right now sees that message.
Okay.
So one writes to the rest of the team, do you think he's just screwing around with us because he's in the onboarding session? So we had somebody up in Fort Collins, Colorado, doing a new rollout of Amaze. Mm-hmm. So we have one of our account managers there standing up in a cafeteria with 80 people in the room. And we have everybody install the Amaze app. And we ask everybody to break the ice. Send us a message. Just introduce yourself, right? Somebody write, hi, I'm Spencer. I'm married. I've got 2 kids. My wife is going to think this is great. And we respond to them. So when we know we're doing those onboarding sessions, we get everybody on our platform, our lawyer, our HR managers, because we're just, because we could have all at once 50 people sending us friendly messages. And so somebody writes to the rest of the team, do you think he's just screwing around with us? And another one writes back, well, I don't think we can take that chance. So the team goes into action. So one person's trying to get a hold of the account manager that's doing the education session. Kind of knew she wasn't going to answer her phone. She's standing up in front of 80 people.
Yeah.
Somebody else is messaging the HR manager.
Okay.
Right? Somebody else is looking up, you can't really always trust the 911 systems when you're calling from outside the area. So they're looking up local EMS so we can make that direct call, right, to local EMS. But the HR manager looks down at her phone, sees the message, tells her there's been an emergency at the office. Would you please ask our account manager to take a 5-minute break and give the office a call? We didn't tell her what was going on. They'll just think it's one of her kids is sick at school or something like that. So this account manager of ours happens to be a physician assistant. She's able to confirm this guy's in the room. So now we know we don't have to dispatch the police, EMS,
right,
or whatever. So she's able to keep an eye on him. At the end of the session, she walks over to him and says, hey, Mike, hey, that message that you sent, was that real? And he said, oh, I didn't know anybody was really going to get that, but yes. And she said, okay, if it's okay with you, I'm on with my office right now. Can I have one of my therapists give you a call? Would you talk to him? And he said, okay. So she watches the therapist call him, right? And he steps out of the room, and the therapist does a deep dive. So this is a really important part of our mental health practice. Again, it's the zero friction, just in time. Right? When somebody's decided, so when people are calling us, in this case, we're calling him, but when people are calling us and they've decided it's time to find mental health support, think about what we put people through. And I'll go back to that in a second. But so this guy does a deep dive with the therapist. Therapist learns that he'd been on antidepressants for about 10 years. He stopped taking them 2 years ago. So not 2 days ago or 2 weeks ago, but 2 years ago when his company switched to a high deductible plan. So it'd probably been almost exactly 2 years because we're in open enrollment here, right? So it was costing him $240 every 3 months to go to a psychiatrist to get a refill prescription on his meds. So he stopped going. Psychiatrist's office doesn't call and check in on him. All right, it's out of sight, out of mind. You cancel your appointment, that's your business. So he stopped taking the antidepressants about 2 years ago. So he's probably been in some kind of spiral ever since. So the therapist, as he's doing this deep dive with him, gets on another screen, and says to one of our nurse practitioners who's got her doctorate degree in psychiatry, taught at a university in this psychiatric program for nurse practitioners, says, hey, I need to get this guy back on his meds. Can you join my call? So the nurse practitioner joins the call. They review some of the history. She gets the medication history. To make a long story short, by noon, we've got him back on his antidepressants. 3 o'clock in the afternoon, he gets back on the phone with the therapist. This guy had checked every box. He had a gun, it was loaded, sitting on the front seat of his car. He had decided when he was going to kill himself, where, why. He had already gone through the thought process. Am I going to leave a note? Who's it addressed to? So the therapist talks him into unloading his gun, taking it to a neighbor, giving the neighbor the gun and our phone number, and asking the neighbor to call us so we can tell him why he's locking up the gun and why he's not giving it back. He has 2 more sessions with that therapist. We then step him down to what we call our peer support team. For about a week, every day, he's messaging back and forth with the peer support partner. I had about a 20-minute call on the phone with him so they can meet. So they're building some rapport and relationship. So this is where this guy is now. He's got a crisis management system. Anytime he needs, he can open up a mobile app and touch a button. He's connected to a medical provider, right away. He's under the care of that nurse practitioner. Every month, he completes a depression screening, and his peer support partner checks in with him. Now, to get his refills, he needed to be on the meds. The psychiatrist had it right.
Discover a better kind of backyard.
But if you do the math, right, at $240
$1,000
a year. Yeah,
right.
yeah.
And time out of his day, hourly worker, right, taking time off, right?
That's the friction you're talking about.
Right, that's the friction, it's the cost. So now his cost is zero, right? His company just pays for his subscription to Amaze. He's got his crisis support team. The peer support partner checks in with him. All he has to do every month is he needs to respond to the peer support partner. Hey, thanks for checking in on me, doing great. Because that way he's reminded, he can also say, this particular gentleman did once, hey, I thought I was doing great. My mom died 3 weeks ago and I'm not doing so good. And that peer support partner can either say, do you want me to, schedule you with the therapist, or you want to just, you and I talk, right? So he's got this support system, but our marginal cost to serve this patient is essentially zero.
Yeah.
Right? The message goes out every month from the peer support partner. He reads it, makes sure everything's good. Our technology tracks, is he doing his depression screening? We can track the scores, make sure he's not trending. And he knows he can escalate to the nurse practitioner, to the therapist, to a doctor in 15 seconds, anytime. And so our focus is on solving problems. The mental health system in the US, and it's kind of like the medical system. Look, I think doctors want to do the right things. The system doesn't allow them to. Same thing in mental health. Mental health is a recurring revenue model. It's all about scheduling the next appointment for the psychiatrist, for the therapist. With Amaze, our goal is to keep our price point low enough that the gentleman I just described, he'll be an Amaze customer for life, right? And that's also very important about Amaze, the portability. So if he leaves his company, if he loses his job, Amaze is affordable. Amaze will be his partner for the rest of his life.
So an individual can decide to then
pick up. Okay. We don't broadly advertise it. We're getting ready to. But when somebody leaves a company, yes, they just convert into one of our consumer customer. They go to another employer that's an Amaze customer. They have what's called a lifetime account number. They just attach that account number to the employer's account, and it goes on the employer's account.
That's fantastic. Having spent years working